Sensitive stomach can mean frequent discomfort, bloating, or pain after eating certain foods or taking medications. Many people experience these symptoms, and they often look for over-the-counter OTC solutions to ease their discomfort. But before reaching for any medicine, it's important to understand what a sensitive stomach is and why it happens. Sometimes it's due to underlying conditions like gastritis, acid reflux, or food intolerance. Other times, stress or lifestyle choices can play a role. In this video, we'll explore common OTC medicines for sensitive stomachs, who should use them and who should avoid them. Let's start by understanding the basics. People with sensitive stomachs often report symptoms like nausea, bloating, mild stomach pain, or even heartburn. These symptoms can be triggered by spicy foods, fatty meals, stress, or even certain medications. Recognizing these symptoms is the first step in managing them effectively. If you frequently experience these issues, it's important to pay attention to what might be causing them. Sometimes, simple lifestyle changes can make a big difference, but when symptoms persist, OTC medicines may help. Let's look at the most common types of OTC medicines used for sensitive stomachs. Antacids are one of the most popular OTC medicines for sensitive stomachs. They work by neutralizing stomach acid, providing quick relief from heartburn and indigestion. Common antacids include brands like Tums, Ralides, and Molox. These medicines are generally safe for short-term use and can be very effective for occasional discomfort. However, they are not suitable for everyone, especially if you have kidney problems or are on a low-sodium diet. Next, we'll discuss how antacids work and who should avoid them. Antacids contain ingredients like calcium carbonate, magnesium hydroxide, or aluminum hydroxide. When you take an antacid, these compounds react with the acid in your stomach, reducing its acidity. This can quickly ease symptoms like burning or discomfort after eating. Antacids are best for occasional use, such as after a heavy meal or when you feel mild heartburn. However, using them too often can lead to side effects like constipation or diarrhea, depending on the main ingredient. Let's see who should be cautious with antacids. While antacids are generally safe, certain people should avoid them or use them only under medical advice. If you have kidney disease, some antacids can cause harmful buildup of minerals in your body. People on low-sodium diets should also be careful, as some antacids contain sodium. Additionally, if you're taking other medications, antacids can interfere with their absorption. Always check with your doctor if you have chronic health conditions or take regular medications before using antacid. Another group of OTC medicines for sensitive stomachs are H2 blockers. These medicines, such as famotidine, Pepcid, and ranitidine, Zantac, now less commonly used, reduce the amount of acid your stomach produces. They don't work as quickly as antacids, but their effects last longer, making them suitable for ongoing symptoms or nighttime discomfort. H2 blockers are often recommended for people who have frequent heartburn or acid reflux. Let's explore how they work and who should use them. H2 blockers work by blocking histamine receptors in the stomach lining. Histamine is a chemical that signals your stomach to produce acid. By blocking this signal, H2 blockers reduce acid production, which helps prevent and relieve symptoms like heartburn and indigestion. These medicines are usually taken before meals or at bedtime. They are effective for people who need longer-lasting relief compared to antacids. However, they are not suitable for everyone, especially those with certain health conditions. H2 blockers are generally safe, but people with liver or kidney disease should use them with caution. These medicines are processed by the liver and kidneys, so impaired function can lead to higher levels in the body and increased risk of side effects. Also, if you are pregnant or breastfeeding, consult your doctor before using H2 blockers. Some people may experience headaches, dizziness, or diarrhea as side effects. Always read the label and talk to your healthcare provider if you have concern. Proton pump inhibitors, or PPIs, are another class of OTC medicines used for sensitive stomachs, especially for frequent heartburn or acid reflux. Examples include omeprazole, Prilosec OTC, and lansoprazole, Prevacid. PPIs work by blocking the final step of acid production in the stomach, providing powerful and long-lasting relief. They are usually taken once daily and are best for people with chronic symptoms. However, PPIs are not meant for immediate relief and should not be used for more than 2 weeks without medical advice. PPIs target the proton pumps in the stomach lining, which are responsible for secreting acid. By blocking these pumps, PPIs significantly reduce the amount of acid produced, helping to heal irritation and prevent symptoms. They are especially useful for people with frequent or severe acid reflux, but they take a few days to reach full effect. It's important to follow the instructions and not exceed the recommended duration of use. Next, let's discuss who should avoid PPI. PPIs are generally safe for short-term use, but long-term use can lead to problems like vitamin B12 deficiency, low magnesium, or increased risk of certain infections. People with liver disease, osteoporosis, or those taking certain medications should be cautious. If you are pregnant, breastfeeding, or have persistent symptoms despite using PPIs, consult your doctor. Overuse can mask serious conditions, so always use PPIs as directed and seek medical advice if symptoms persist. Simethicone, found in products like Pepto Bismol, is another OTC option for sensitive stomachs. It works by coating the stomach lining and reducing inflammation, which can help with symptoms like nausea, indigestion, and mild diarrhea. Bismol is often used for temporary relief, especially after eating something that didn't agree with you. However, it's not suitable for everyone, especially children and people with certain allergies. Simethicone coats the stomach and intestines, protecting them from irritants and reducing inflammation. It also has mild antibacterial properties which can help with certain types of diarrhea. This medicine is useful for short-term relief of upset stomach, nausea, and mild diarrhea. However, it can cause darkening of the tongue or stool, which is harmless but can be alarming. Let's see who should avoid using bismuth-subsalicylate. Bismuth-subsalicylate should not be used by children or teenagers recovering from viral infections due to the risk of Ray's syndrome. People allergic to aspirin or salicylates should also avoid it. If you have bleeding disorders, kidney problems, or are pregnant or breastfeeding, consult your doctor before use. Always read the label and use the medicine as directed to avoid complications. Simethicone is an OTC medicine used to relieve bloating and discomfort caused by excess gas in the digestive tract. It works by breaking up gas bubbles, making them easier to pass. Simethicone is found in products like Gas-X and Mylicin. It's generally safe for most people and can be used as needed for temporary relief. Let's look at how simethicone works and who should use it. Simethicone acts as an anti-foaming agent, breaking up gas bubbles in the stomach and intestines. This helps reduce bloating, pressure, and discomfort. Simethicone does not affect stomach acid or digestion, making it a gentle option for those with sensitive stomachs. It can be used after meals or whenever you feel gassy. Side effects are rare, but as with any medicine, it's important to use it as directed. Simethicone is considered very safe with few reported side effects. However, if you have a known allergy to any of its ingredients, you should avoid it. If your symptoms persist or worsen, consult your doctor, as this may indicate a more serious underlying condition. Simethicone is safe for children and adults, but always follow the dosing instructions on the package. Digestive enzyme supplements are sometimes used by people with sensitive stomachs, especially if they have trouble digesting certain foods. These supplements contain enzymes that help break down proteins, fats, and carbohydrates, making digestion easier. They are available OTC and can be helpful for people with conditions like lactose intolerance or pancreatic insufficiency. However, they are not suitable for everyone and should be used with caution. Digestive enzymes help your body break down food more efficiently, reducing symptoms like bloating, gas, and discomfort after meals. For example, lactase supplements can help people with lactose intolerance digest dairy products. These supplements are usually taken with meals and can provide targeted relief. However, they should not be used as a substitute for a balanced diet or to mask serious digestive issues. Digestive enzyme supplements are generally safe for most people, but those with allergies to the ingredients or underlying health conditions should consult a doctor before use. People with chronic pancreatitis or other serious digestive disorders should only use these supplements under medical supervision. Overuse can sometimes cause diarrhea or abdominal cramps. Always read the label and follow dosing instructions. Fiber supplements such as psyllium metamucil or methylcellulose citrusol can help regulate digestion and relieve symptoms like constipation or mild diarrhea. They work by adding bulk to the stool and promoting regular bowel movements. For people with sensitive stomachs, fiber supplements can be a gentle way to support digestive health. However, they must be used correctly to avoid side effects. Fiber supplements absorb water in the digestive tract, forming a gel-like substance that helps move stool through the intestines. This can relieve constipation and promote regularity. Some types of fiber can also help with mild diarrhea by absorbing excess water. It's important to drink plenty of water when taking fiber supplements to prevent blockages or discomfort. Let's discuss who should avoid these supplements. Fiber supplements are generally safe, but people with certain digestive conditions such as bowel obstructions or severe narrowing of the intestines should avoid them. If you have difficulty swallowing or are on a fluid-restricted diet, consult your doctor before use. Adding fiber too quickly can cause bloating or gas, so it's best to start with a small dose and increase gradually. Probiotics are supplements containing beneficial bacteria that support gut health. They can help balance the digestive system, especially after antibiotics or during periods of digestive upset. Probiotics are available OTC in capsules, powders, or even certain foods like yogurt. For people with sensitive stomachs, probiotics can help reduce bloating, gas, and irregularity. However, not all probiotics are the same, and some people should use them with caution. Probiotics introduce healthy bacteria into the digestive tract, helping to restore balance and improve digestion. They can be especially helpful after a course of antibiotics, which can disrupt the natural gut flora. Probiotics may also help with symptoms like bloating, gas, and mild diarrhea. However, the effects can vary depending on the strain and individual response. Let's see who should avoid probiotics. Most people can safely use probiotics, but those with weakened immune systems, such as people undergoing chemotherapy or with HIV/AIDS, should avoid them unless advised by a doctor. Rarely, probiotics can cause infections in vulnerable individuals. If you have a serious illness or are taking immunosuppressive drugs, consult your healthcare provider before starting probiotics. For those with sensitive stomachs who experience occasional diarrhea, OTC antidiarrheal medicines like loperamide and Imodium can provide relief. These medicines slow down the movement of the intestines, allowing more water to be absorbed and reducing the frequency of bowel movements. They are best used for short-term relief and are not suitable for all types of diarrhea. Antidiarrheal medicines like loperamide work by slowing the movement of the intestines, which helps the body absorb more water and form firmer stools. This can quickly reduce the urgency and frequency of diarrhea. However, these medicines are not suitable for diarrhea caused by infections or certain medical conditions. They are meant for short-term use only and should not be overused. People with bloody or high fever diarrhea or those with chronic digestive diseases like ulcerative colitis should avoid antidiarrheal medicines unless directed by a doctor. These medicines can worsen certain infections or mask serious conditions. If you have liver disease or are pregnant, consult your doctor before use. Always follow the instructions and seek medical advice if symptoms persist. Antiemetic medicines are used to relieve nausea and vomiting. Some OTC options include meclizine, dramamine, and dimenhydrinate. These medicines are often used for motion sickness or mild stomach upset. They work by blocking signals in the brain that trigger nausea. However, they can cause drowsiness and are not suitable for everyone. Antiemetic medicines block certain signals in the brain that cause nausea and vomiting. They are especially helpful for motion sickness or mild stomach upset. These medicines are usually taken before travel or when symptoms start. Side effects can include drowsiness, dry mouth, or blurred vision. Let's see who should avoid antiemetics. People with glaucoma, enlarged prostate, or certain heart conditions should avoid antiemetic medicines unless advised by a doctor. These medicines can worsen certain medical problems or interact with other drugs. Pregnant or breastfeeding women should also consult their doctor before use. Always read the label and use as directed. Antispasmodic medicines such as dicyclomine are sometimes used to relieve stomach cramps and spasms. While most are prescription only, some OTC options may be available in certain countries. These medicines work by relaxing the muscles of the digestive tract, easing pain and discomfort. However, they are not suitable for everyone and can cause side effects. Antispasmodic medicines relax the smooth muscles in the digestive tract, reducing cramps and spasms. This can provide relief from pain and discomfort, especially in conditions like irritable bowel syndrome (IBS). However, these medicines can cause side effects like dry mouth, blurred vision, or constipation. Let's discuss who should avoid antispasmodics. People with glaucoma, urinary retention, or certain heart conditions should avoid antispasmodic medicines unless prescribed by a doctor. These medicines can worsen some medical problems or interact with other drugs. Pregnant or breastfeeding women should also consult their doctor before use. Always use as directed and report any unusual side effects. Some people with sensitive stomachs may need pain relief for headaches or other minor aches. However, common OTC pain relievers like ibuprofen and aspirin can irritate the stomach lining and worsen symptoms. Acetaminophen Tylenol is generally considered safer for those with sensitive stomachs, but it should still be used as directed. Let's explore the best options and precautions. Acetaminophen is less likely to cause stomach irritation compared to NSAIDs like ibuprofen or aspirin. It's a good choice for people with sensitive stomachs who need pain relief. However, it can affect the liver if taken in high doses or with alcohol. Always follow the dosing instructions and avoid combining multiple medicines that contain acetaminophen. If you have liver disease, consult your doctor before use. NSAIDs like ibuprofen and aspirin can cause stomach irritation, ulcers, or bleeding, especially in people with sensitive stomachs or a history of digestive problems. If you have a history of ulcers, gastritis, or take blood thinners, avoid NSAIDs unless prescribed. Always use the lowest effective dose for the shortest time possible and take with food if needed. While OTC medicines can help manage sensitive stomach symptoms, it's important to know when to seek medical advice. If you have severe or persistent symptoms, unexplained weight loss, blood in your stool, or difficulty swallowing, see a doctor promptly. These could be signs of a more serious condition that requires professional evaluation and treatment. Use OTC medicines safely. Always read the label, follow dosing instructions, and be aware of potential interactions with other medicines. Don't use multiple products with the same active ingredient, and avoid exceeding the recommended dose. If you have chronic health conditions or take prescription medicines, check with your doctor or pharmacist before starting any new OTC product. Medicines can help, but lifestyle changes are often key to managing a sensitive stomach. Eating smaller, more frequent meals, avoiding trigger foods, managing stress, and staying hydrated can all make a big difference. Keeping a food diary can help you identify patterns and avoid foods that cause discomfort. Let's look at some practical lifestyle tips. Try to eat slowly and chew your food thoroughly. Avoid lying down immediately after eating and limit caffeine, alcohol, and spicy foods if they trigger symptoms. Regular exercise and stress management techniques like meditation or yoga can also support digestive health. Remember, small changes can add up to big improvements over time. Always read the labels on OTC medicines carefully. Look for active ingredients, recommended dosages, and warnings about interactions or side effects. If you're unsure about a product, ask your pharmacist for advice. Being informed helps you make safer choices and avoid unnecessary risks. Sum up, there are several OTC medicines that can help with sensitive stomach symptoms, including antacids, H2 blockers, PPIs, bismuth subsalicylate, simethicone, digestive enzymes, fiber supplements, probiotics, antidiarrheals, antiemetics, and antispasmodics. Each has its own benefits and risks, and not everyone should use every medicine. Always consider your health history and consult a healthcare provider if you're unsure. Managing a sensitive stomach often requires a combination of safe OTC medicines, lifestyle changes, and professional guidance. By understanding which medicines are appropriate and who should avoid them, you can make informed choices for your digestive health. Remember, your well-being is important, and there's always help available if you need it. Take care of your stomach, and it will take care of you.